right at the beginning.
Terrible.
Some of you still don't even know how. Lord. And you were in the military? Doesn't everything manual there? No?
No, they've gone to the old.
They've gone to the
drive.
They've gone some.
Okay. My grandfather was like, if you learn how to drive a stick shift, you learn how to drive anything. So
That's the way it was in my house.
Yep. So there's some things that we have here. Okay. I know. I saw that. I was like, oh, I'm grabbing this one for the demo. We have our NG tube. Now these come in different sizes. They can get. Typically, they're about 30 some inches long. But as far as the diameter, it's in French.
Okay.
Not like wee French, but like this is a 14 French. 14, 16 French is average. Okay. Obviously, the smaller the number, the smaller the size. Okay. So you would probably use an 8 or a 9 on a kid. Okay, much smaller. If your patient's a real jerk, you can go up to
They get bigger.
Yeah. Now, this is not a sterile procedure. It's a clean procedure. Okay. Sterile procedure, I would be using what kind of gloves?
Sterile.
Sterile gloves. All right. So, this is actually not a 14. This is a 10. This is
Someone
small.
packaged it very wrong.
Yes. Now, we didn't have this on Wednesday.
No.
These are very important. They usually don't come in the packet. They usually come separate, and this is called an anti-siphon valve. Because on here, there's all these nice little holes along the final 3 or 4 inches of this. And these are typically hooked up to suction. And so if this gets along the inside of the stomach like this, and there's just continuous suction, you can actually cause hickeys on the inside of the stomach lining and cause damage. So what this does is it helps to regulate the suction. So that way it doesn't get that suction up against the tissues if it doesn't have that strong of a suction against it. Okay, it doesn't cause the tissue damage. They will come with this lovely little adapter. Okay, and this helps you to connect your tube. It did.
I'm back here.
To your suction. Okay, and then you have back here, we have our suction canister where all the fun stuff comes and gets collected. And then we have our suction regulator here. Okay, I will go over that more, not even today, but a little bit later.
Yeah.
Okay.
Because we don't have the proper one hanging.
Yes, we don't, unfortunately. So,
Now, there are 2 different sides to this. The blue side is to clamp it off. The white side is to vent. Okay? So if you're just going to clamp it off, you're just going to stick this in here, and then this would go into the other side. So if you're traveling, so you don't get goo everywhere. Okay? You just want to vent it, then this would go in here. There's no wrong way to use it, really.
well.
There is, but there isn't.
Yeah,
So if
sometimes people will just do it this way, and it's like, that's not how that works.
No, it doesn't.
But,
You
now.
get more in depth when you are being precepted at the bedside.
Yes. Now, how do we measure for this? Correct. So I'm going to take the tip of my NG tube to the tip of their nose, roughly. It doesn't have to be perfectly.
Slap it to their face.
Again, these are like the pirate code. They're more like guidelines. Okay? It's going to be an estimation at this point. So we're going to go from the tip of the nose to the tragus of the ear, or the ear opening. From there down to the xiphoid process. That gives us a good estimation. Okay, flat chest.
Yes.
A good idea about where the stomach is and how far we need to go. Okay, now in the video, I do believe she tapes it or marks it. That's perfectly fine. You don't have to. Now this one does not have measurements on it. It has little black notches on it, but some of them, I think the other ones that you guys will have access to, actually have numbers in millimeters. Okay, so you will need to measure and know what that number is, because when you go in to maintain, if the patient has this already, you need to know how far in it is to see if it's gone further down or if it's come up and out. Okay, because there's still a huge aspiration risk with this if it comes out too far. Okay. So we can take a piece of tape and mark it where we need to.
You don't need a gargantuan piece
No.
either.
Just for marking purposes, it's just so you don't go too far, but far enough, okay? Just a marker. Then I'm going to, I'll use this today, didn't on Wednesday, didn't go very well. I'm gonna put my gloves on now. What should I do before I start just ramming this down my patient's nose?
Look at his,
Huh?
examine his.
Well, even before that, I'm gonna tell him what I'm doing.
Yeah.
Just come at him with the nose. First thing he's gonna do is jump out of the bed and run away.
I don't
He'll be like, see ya, I don't wanna meet ya.
Who do you work for?
So you
My
wanna make
Stranger
sure they
Things
have this?
piece, yes.
What's this?
This is a piston syringe. Okay, it works the same as any syringe except this one is only for an NG tube. Okay, so it is important to have that along with some water to make sure that you can flush this. Okay, we do have here as well a little sip of water for your patient because once you get to a certain point, you want them to be swallowing so that way it goes into their stomach or their esophagus rather than their windpipe, their trachea. Okay, if your patient, you're trying to put this in and they are continuously coughing, what do you think you need to do?
Pull it out.
Stop, pull it out, and try again, okay? Sometimes with these, because if their anatomy's off, you might have to really bend these to get a nice little curve so that goes in a little easier, okay? But I'm going to check the nares and look to see if there's any obstructions, any deviated septum, anything along those lines. I'm going to pick whichever one looks the best, the most clear if there is, okay?
And on your paper, checkoff paper, it says to put the head back.
No.
It's incorrect.
Yes, I need to fix that. All right, so we are going to straighten up that nasal passage. We don't want this to go down before we're ready for it. So by having them tilt down, it causes a little bit of an angle, so that way when we get to the back, we can then go full force and we'll know. And then that's when we have them start sipping the water, okay? Now, you'll wanna have them tilt their chin to their chest. And just like in the video, as soon as the nurse put this in there, what did the patient do? Okay, so it's always good to have another person in the room with you to kind of hold their head in place because they can be strong. Okay, so I'm going to come in, I'm going to go straight back and push,
Swallow, please.
and as soon as I feel resistance, start swallowing. Okay.
Swallow.
If I need to twist it, I'm going to twist the NG tube towards the septum, okay, and continuing to advance.
Now mind you, these won't go very far.
No, because I think they stop like right here. Yeah, I'm going to stop around right there. And we're going to look in the mouth to see, because sometimes they can coil in the back of the throat, okay. So you should be able to see a tube going down the back
Don't
of the
use your
throat.
fingers.
Yeah, well, for us today, we don't have to worry about being
Yeah.
bit. But if you have your pen light, come take a look, and you can see in the back of the throat.
You see that back there?
No coiling.
No coil.
coiling. But you can see the tube.
Come all around, take a look.
Bring your camera. Throw it in there. Well, you should be able to see.
You might not need a pen light with this light directly above us, but you should be able to
Shine
see
it
a
in
white
the
line in the
throat
back.
On that side, right?
Oh, I can.
Mm-hmm.
You can see it? There we go. So y'all can see it. It rides right by the uvula there.
Fancy.
I know, it's like, I'm so short. Okay, yeah. This is like.
We'll turn this head for you.
Get back there and really push the tongue down.
We're gonna borrow your light for a moment, Doc. So all can see.
Back there.
Just get on a stool.
I know, I'm like, open up.